If you're constantly dealing with cold feet, what I'm about to tell you might surprise you. Most people think it's just poor circulation, but after treating thousands of patients, I've discovered there are actually 5 causes, and getting the wrong treatment can make things worse. My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas. In today's video, I'm going to show you exactly why your feet are always cold, the warning signs that it might be something serious, and the simple solutions that most doctors never mention. Most people assume cold feet automatically mean poor circulation. While that can be true, it's actually the least common cause I see in my practice. What's even more concerning is that treating for poor circulation when that's not the real cause can mask serious underlying conditions. The first cause of cold feet might shock you. It's actually your nervous system, not your circulation. When your nerves aren't communicating properly with your brain, they can send incorrect temperature signals. Think of it like a faulty thermostat in your house. The temperature might be fine, but the sensor is telling you it's cold. The nerve-related cold sensation often starts gradually. You might notice your toes feeling cold even when the rest of your foot is warm. This is particularly important because it could be an early warning sign of peripheral neuropathy, especially if you're diabetic. Here's a simple test you can do right now. Touch your feet with the back of your hand. If they feel like a normal temperature to your touch but still feel cold to you, that's a strong indication we're dealing with a nerve issue rather than circulation. The second cause relates to your blood vessel's natural response to temperature change. Your blood vessels should expand and contract to regulate temperature. However, some people's vessels overreact to the slight temperature changes. This condition, called Raynaud's phenomenon, can make your feet feel ice cold even in mild temperatures. What makes Raynaud's particularly tricky is that it often affects just certain toes and not your entire foot. You may notice 1 or 2 toes turning white or blue while others remain normal. This isn't something to ignore. Proper treatment can prevent long-term damage to your blood vessels. The third cause involves your body's stress response. When you're under stress, your body redirects blood flow to vital organs, leaving your extremities with reduced circulation. This is why many people notice their feet getting colder during periods of anxiety or stress. But here's what most doctors won't tell you about stress-related cold feet. It becomes a self-perpetuating cycle. The more you worry about your cold feet, the more stress you experience, which in turn makes your feet colder. Breaking this cycle is crucial for finding relief. The fourth cause relates to your thyroid function. Your thyroid gland controls your body's metabolism and temperature regulation. When it's not functioning optimally, one of the first signs can be chronically cold hands and feet. The surprising part, your thyroid can be affecting your foot temperature even if your basic thyroid tests come back normal. Here's a key point about thyroid-related cold feet. They tend to be consistently cold throughout the day, unlike circulatory issues which often worsen with activity. The distinction is crucial for proper treatment. The fifth cause involves your muscle function. Your calf muscles act like pumps, helping to move blood through your feet. When these muscles aren't working efficiently, blood can pool in your feet, making them feel cold. This is why people who sit for a long period often develop cold feet. Now here's something crucial about muscle-related cold feet. Simply wearing warmer socks won't solve the problem. You need to activate those muscle pumps to improve blood flow. I'll show you some specific exercises in a moment that can make a dramatic difference. Many of my patients make the mistake of trying to treat their cold feet by wearing multiple pairs of socks. This might provide temporary relief. It can actually make the problem worse by reducing circulation even further. Think of it like wearing a tourniquet. Too much compression can restrict blood flow. Instead of piling on more socks, focus on improving circulation through movement. Simple exercises like ankle rotation, toe spreads, and calf raises can significantly improve blood flow to your feet. The key is doing these exercises regularly throughout the day, not just when your feet feel cold. Here's a specific routine that's been proven effective. Start with 10 ankle circles in each direction. Follow this with toe spreads. Imagine trying to spread your toes like a fan. Finally, do 15 calf raises while holding onto a chair for balance. Repeat this sequence 3 times daily. Temperature contrast therapy can also be remarkably effective. Alternate between warm and cool water to stimulate blood flow. Start with warm water for 3 minutes and switch to cool, not cold water for 1 minute. Repeat this cycle 3 times, always ending with warm water. Your choice of footwear plays a crucial role in managing cold feet. Tight shoes can restrict circulation, while shoes that are too loose don't provide the support necessary for proper muscle function. The ideal shoe should have enough room for your toes to move freely while providing good arch support. Many people don't realize their cold feet might be connected to their overall cardiovascular health. If you notice your feet getting colder with activity, or one foot is consistently colder than the other, these could be warning signs of cardiovascular issues that need immediate attention. For those dealing with nerve-related cold feet, certain supplements might help. B-complex vitamins, particularly B1, thiamine, can support healthy nerve function. However, always consult with your healthcare provider before starting any supplement regimen. Proper foot hygiene is also essential for managing cold feet. Keeping your feet clean and dry helps prevent fungal infections that can infect circulation. Use a moisturizer after washing to prevent skin from becoming dry and cracked, which can further impair circulation. If you're experiencing persistent cold feet, especially if accompanied by color changes, numbness, or tingling, it's important to get evaluated by a podiatrist. These symptoms could indicate underlying conditions that require professional treatment. Remember, cold feet aren't something you have to simply live with. Understanding the real cause is the first step towards finding an effective solution. Don't make the mistake of assuming that poor circulation and trying to solve it with warmer socks. If you're experiencing any of the warning signs we discussed today, schedule an appointment for a proper evaluation. The sooner we identify the real cause of your cold feet, the sooner we can implement an effective treatment plan. If this information helped you understand the real cause of cold feet, please give the video a thumbs up and subscribe to the channel. Share it with anyone you know who struggles with cold feet. You might help them find relief from a problem they thought they had to live with. Thanks so much for watching, and have a great day.